Good afternoon, everyone. I'm Tara Britton with the Center for Community Solutions. We're going to get started here in just a moment. We'll let everyone join onto the webinar. Hi, everyone. Thanks for joining us today. I'm Tara Britton with the Center for Community Solutions. You'll be hearing from all members of our policy team today on the webinar to dig into what is in the state budget, what's changed since literally yesterday in less than 24 hours, and we are going to jump in right now. I'll cover a few housekeeping items. I know there's usually questions around, will we share the slides? We will be sharing those after the webinar has concluded. We will also have the webinar recording posted to our website eventually. That doesn't happen right away, but we will get it posted as soon as we can. Any other questions that folks have throughout the webinar, please submit them to the chat feature. Anytime they come up. So as a question arises, submit it through the chat feature, and we will field all of those at the end, toward the end of the webinar. So we have built into our day leaving time for questions at the end. I'll have our team introduce themselves as they sort of start on each section of the webinar. We're each covering various parts of Health and Human Service policies that appear in the state budget. I'm going to kick it off by just talking a little bit about process. So you likely have heard a lot of things in the media and on Twitter for those of us who are on social media around the proceedings of the state budget. So here is the timeline that the budget is on in a year when we have a new governor. It starts a little bit later into the year in mid-March. We saw the governor's budget proposal, and it's been working its way through the House of Representatives. It works through the House Finance Committee, the subcommittees of the Finance Committee hear specific areas of the budget. So, for example, Health and Human Services Subcommittee of Finance is where we've heard a lot of the provisions that we will be covering today. And then it moves back to the full House Finance Committee to be voted out and moved to the House floor. So that is, we are literally in the midst of that. Yesterday, the House Finance Committee voted the bill out of committee, and today it moves to the House floor. The House is scheduled to hold session in about an hour. So that's where we are in the process. Once it moves out of the House, it goes over to the Senate. And more than ever before this year, the Senate has been holding preliminary or informal hearings on the state budget. So over the last about 3 weeks, the Senate has been holding informal hearings on the budget. They're informal because they don't have the passed budget out of the House. So they've been hearing testimony from agency directors over the last few weeks in Senate Finance, as well as the Senate Finance subcommittees that hear individual areas of the budget, because they really wanted to get a jump on things and start to dig into the budget despite not having a final bill. So once we see that come out of the House next week, the Senate subcommittees will, they're in various stages of testimony. I know the Senate Health and Medicaid Subcommittee, Senate Finance Health and Medicaid Subcommittee will be hearing public testimony next week. So we'll see the bill move through the Senate, hopefully by early to mid-June, and then the bill, there will inevitably be differences between the House and Senate versions of the budget bill, and it will go to a conference committee in mid to late June. We don't know all of the members of the conference committees yet, although the usual mix of folks are the finance chairs and ranking members from both chambers of the General Assembly. And then once they concur on their changes, the budget moves to the governor's desk. And by state law, the budget has to be done by June 30th of this year in order for it to start paying for services and other areas of the government on July 1st of this year. So that's the process. You have a sense of where we are on things now. I'm going to jump into specific areas of the budget. And I'm going to move through some of these pretty quickly because we want to make sure we have time for all of our team to present. So just please submit any questions that you have. I know folks had a chance to submit questions ahead of time too. So moving into the Department of Health, I would say that this is one of the areas where we certainly see investments in a service that Governor DeWine really talked a lot about during the campaign and in his early days of office around expanding home visiting for babies and parents, young children and parents and babies. The goal is to double, the proposed budget includes doubling of the state investment with a goal of tripling the reach of the program. So right now there's, in the Help Me Grow portion of this program, which sits at the Department of Health, there's about $20 million for this program each year. In 2020, the proposal is to double that to about $40 million and then go even beyond that in 2021 to $50 million. And this will work in conjunction with the early intervention services that run through the Department of Developmental Disabilities. These all work together. And this is a way to really improve outcomes for children and parents. Another big initiative focused again on, primarily helping improve kids' outcomes. There's a lot around lead abatement activities. Much of this lives in the Department of Health's budget. There actually isn't a ton of money in terms of how many millions of dollars sit in the Department of Health's budget to engage in some of these activities around abatement and demolition of lead-blighted properties. But they are needed investments and a move in the right direction in terms of the state showing leadership on this issue. So having that leadership at the state level around improving and increasing activity around abatement and demolition is really a strong move, a strong sign to communities around the state that the state government and the leadership at the state value this as a strategy to help improve kids' outcomes. There's also some money to support additional folks getting licensed to do lead related work in terms of inspections and demolition and abatement. And then there's also a partnership between the Department of Health and the Department of Taxation around tax credits for dealing with properties that have lead issues and offering tax credits to deal with that. Another piece of, a big piece, again, very kid-focused in the Department of Health's budget is an initiative to raise the legal age of tobacco purchase from 18 to 21. And this is something that has been done in some communities around the state of Ohio, around the country, certainly is aimed at reducing the incidence of younger people starting any sort of tobacco use. This also does apply to the broad array of tobacco products, not just cigarettes. There is an ongoing discussion around this language in the budget to improve the impact of this policy change. So currently it's a pretty simple change to say everywhere in state law where it says that the legal purchase age is 18, we want to change it to 21. And that's needed but not sufficient to make sure that we have enough support for enforcement and any penalties for those who sell products to people younger than 21. And there's a lot of sort of that public health infrastructure that needs to be supported around implementation of a change to the legal age for purchase. Hang on one second. Looks like the slides went away on my end. Oh, I'm reconnected. Okay. So another piece of the Department of Health's budget, and this is a little bit of what has changed as it relates to the substitute bill, the Department of Health had proposed to establish or were authorized to create review committees around drug overdose fatalities and fetal infant mortality. Those would be more at the local level, that the Department of Health would help to facilitate the creation of these review committees that looked at the circumstances of these deaths to try to learn from them and prevent similar instances in the future. Similarly, the pregnancy-associated mortality review, so all three of these review committees were included in the governor's proposed budget. The first two were removed in the substitute bill. The third one was as well, but it was added back in as of yesterday in the omnibus amendment in the House Finance Committee. The pregnancy-associated mortality review is actually just one committee that sits at the Department of Health. That one was added back in a amendment that was accepted in the House Finance Committee proceedings yesterday. So again, a little bit about what changed yesterday in the amended substitute bill. I mentioned the one key piece around the pregnancy-associated mortality review committee being added back in. There was some additional language added in around the Tobacco 21 initiative to support, to earmark some of the dollars associated with tobacco sort of cessation and enforcement more toward those enforcement pieces and the penalties and things like that associated with changing the age from 18 to 21, although my understanding is that it's not the sort of full gamut of policies that are really needed to support an effective change in legal purchase age. There was not a lot of change on the home visiting front in terms of dollars. The changes there can be summed up in that it kind of broadens the types of entities that can be providing home visiting services and kind of trying to bring home visiting services provided through the community pathways hub models into the system. So there isn't sort of a formal change around any sort of certification on home visiting services, but it does say, you know, any entity that is providing evidence-based home visiting, we should be looking at them and counting on them as providers in the system. So that's the Department of Health. I'm going to move into the next agency I'm covering, and then I will turn it over to my colleague. So moving into the Department of Job and Family Services, the big changes here, and these have been widely covered in the media, are big increases to the child welfare system. So the governor's budget included an additional $74 million in each fiscal year for child welfare. That was double what had been in our state support line for child welfare previously. And the House version of the budget actually adds an additional $30 million to that in each fiscal year. So it's a significant increase in child welfare funding. And I think the important thing to remember here too is this allows us to draw down additional federal dollars. So that's a really important, needed increase in a very overwhelmed system. The issue of multi-system youth is something that Community Solutions has been working on for several years. These are kids who have some involvement in, as it says there, multiple systems, so juvenile justice, behavioral health, developmental disabilities, and these children are, sometimes the scenario is that they're in a family that is fully supportive of finding them the best possible treatment and services available, but have just not been able to find what they need through private insurance and navigating the system kind of on their own as a family, and they sometimes have to relinquish custody of their child to the child welfare system in order to receive services, under a very tragic situation. We know that some of the increase to the child welfare line can be used to help support kids who have had custody relinquished to the child welfare system in this situation, but it can also be used to help prevent that custody relinquishment. So there is some ability to utilize those increased funds for these kids. Another big issue that Community Solutions has been following is around the Temporary Assistance for Needy Families, or TANF program. We reported last year that there was a significant surplus in the budget, in the TANF spending plan or state TANF budget of about $550 million. And what we know now, based on the presentation from the director of the Department of Job and Family Services, is that that surplus is budgeted to be exhausted by fiscal year 2023, or through fiscal year 2023, and that is in order to support implementation of Step Up to Quality in the child care system, which means that higher rates will be paid to providers once they reach certain levels of quality, and that is an area where I think there's broad concern around sustainability, and there, in the next bullet point, I talk about how there are no new state dollars dedicated to child care. So the goal in this budget, utilizing increased federal funds, is to ensure every child in the publicly funded system is receiving care that is in a quality setting. So that's the first step, but with no new state dollars, the increase in eligibility that has been discussed for child care was not included. So what changed in the sub-bill yesterday? Not a lot in this agency, really. That $30 million additional increase to the child welfare line was actually in the initial substitute bill that we saw come out of House Finance last week. So we knew about that already. It was not in the omnibus, but it stayed in. We also saw some changes around, not necessarily changes, I would say kind of a way to move forward around the issue of multi-system use. There was a joint legislative committee that met a few years ago to develop recommendations about how to better address this issue of multi-system use and to prevent this issue of custody relinquishment to receive services. And there was language inserted into the budget that said, we're going to implement those recommendations from the Joint Legislative Committee. We want to figure out how to end this issue of custody relinquishment. So I would say that's some of the big changes. There's still a little bit of, I think, sorting out to do in some of the changes in the Job and Family Services budget. There was a little, I would say, some vague language in a couple places around drawing down federal dollars for an employment program that we're still trying to sort out a little bit, but stay tuned. We, coming from Community Solutions and lots of our fellow stakeholders, you will be hearing lots about changes in the budget over the coming days and weeks. So I'm going to turn it over to my colleague who can introduce himself and talk about programs and services for older adults. And just a reminder, this is still Tara, just a reminder that any questions you all have, please submit them through the attendee chat as they come up. We will be compiling those and sharing them at the end and answering them to the best of our ability.
All right. Okay, so sorry about that. Got temporarily disconnected, so I apologize to everyone for that. This is Will Tarter, and in the Cleveland office to talk about programs and services for older adults. As you may know, older adults is one of the 5 state budget policy priorities for the Center for Community Solutions, as older adults is a part of our overall strategic plan. So we pay very close attention to line items that would significantly impact the older adult population across Ohio. There are a few things that I would like to touch base on today. One of the things that was very interesting to CCS was the impact of the governor's budget on older adults and what the governor would propose on specific issues on things like adult protective services. So the aging population increases across the state. How will the state address some of the support systems that will be needed with an aging population. Another thing that we wanted to keep a very close eye on was what would the House do with the overall kind of focus on other policy priorities, as Tara just alluded to, especially children. How would seniors be addressed in the House version as well? There were some changes that we'd like to call attention to some of those things today, and that's what we're going to do in the next slide. All right, so the very first thing that we wanted to focus on is the overall agency budget for the Department on Aging. There was no changes in the funding levels for the Department on Aging in the substitute House version of the budget. That is very significant, as there were some things that we at CCS and also the Council on Older Persons, which is a standing committee of the Center for Community Solutions, are paying very close attention to. One of those things is Alzheimer's and dementia care. Ohio remains one of the only states in the country that does not have an Alzheimer's state plan. So the Council on Older Persons is starting to pay very close attention to the impact of Alzheimer's public policy in the budget and how that could impact the overall policy creation process. And we can talk about that another time. But that was one line item that we're paying close attention to. Another thing that we wanted to pay close attention to was the Long-Term Care Ombudsman's Office. The Long-Term Care Ombudsman's Office received a significant increase in funding from the governor's budget that was introduced. It saw a $1.3 million increase in the fiscal year 2020 and a $2.5 million overall increase in fiscal year 2021. The Office of the Ombudsman is the long-term care advocate for consumers and helping them select long-term care options. The Ombudsman also provides technical assistance and resources for improving quality and person-centered care in nursing facilities. And so to see the increase was very encouraging in the governor's budget. The House version did not increase beyond the governor's proposal, so that increase did remain in the House version from the governor's introduced budget. Another thing that Center for Community Solutions was paying very close attention to is the Senior Community Services line item, which did see an increase of $1.2 million in the governor's budget, and that increase remained in the House version. What that would do is that would expand the Senior Farmers Market Nutrition Program, which is currently operating in about half of Ohio's counties, and would expand the program to all 88 counties across the state. Other organizations, especially the AAAs, have been advocating to increase the Senior Community Services line item because it has seen different changes throughout the years in decreasing in funding, and so that was one thing that we wanted to see would that change, and it did not change in the House version of the budget. Lastly, although not located in the Department of Aging, Adult Protective Services is located in the Ohio Department of Job and Family Services portion of the budget, though it does directly affect older adults across the state. The governor had proposed maintaining the funding for Adult Protective Services of $2.7 million. The House version increased Adult Protective Services up to $4.2 million. That's pretty significant because that would allow for each county to have at least a full-time person to address the topic of adult protective services. That $4.2 million is split evenly across the state, so to have a dedicated individual who knows the needs of older adults and can address them is very significant, and many advocates are pleased to see adult protective services get an increase in the House version of the budget. Though there's still some advocacy to go, as folks want to see increase in support for adult protective services to prevent financial abuse or physical abuse. To see an increase in the House version of the budget is very encouraging to older adults and the services that will be needed. So what changed in the amended substitute bill? Not much. We did see the adult protective services increase, and we did see the increases that were proposed in things like the Senior Community block grant to be maintained, so that is encouraging. But one of the things that we want to pay very close attention to is how the Senate will address some of the changes. Will they keep some of the increases that have been proposed by the House, or will they make changes on their own? So stay tuned. And now I'm going to turn it over to my colleague, Adam, who will talk about mental health.
Thanks, Will. I'm Adam White. I'm a policy and research assistant down here in Community Solutions Columbus office. Like Will said, I'm going to run over the mental health and addiction services component of the budget. I think this is one of the more exciting areas of this particular budget because there are quite a few significant investments in this space coming out of the governor's budget proposal and that have been preserved through the House so far. Governor DeWine has been very vocal about making recovery and investing in meaningful solutions to address Ohio's mental health and addiction crisis, and making those investments a priority in his budget. And that really started with the governor's creation of the Recovery Ohio Advisory Council shortly after he took office. And that body made up of stakeholders and providers and advocates and people living with substance use and mental health disorders. That group released a very comprehensive report of over 75 recommendations shortly before the governor's budget was introduced. And we saw in the governor's budget that many of those investments really took into account the recommendations coming out of the Recovery Ohio initiative. So as you might expect, many of those live in the Department of Mental Health and Addiction Services. And really not much in this space had major changes through the House substitute bill or the omnibus amendment yesterday. So what I'll do is just kind of go over all the major investments that have come out of the governor's budget proposal, and where appropriate, I'll identify areas that have been tweaked by the House. So one of the big initiatives is $12 million over the biennium to expand the Ohio START program, which stands for Sobriety, Treatment, and Reducing Trauma. This was actually a program that was really championed by Mike DeWine during his time as Attorney General, so it's no surprise that it's being really featured in the budget. This program offers targeted intervention services to families, especially families where a child has experienced trauma due to their parents' substance use disorder. So the program offers counseling services to those children, as well as intervention and referrals to treatment for the parents. And the $12 million over the biennium is intended to expand the program from 34 counties up to 64 over the biennium. Another big investment is around specialized dockets. So when we say specialized dockets, we're talking about drug courts or mental health courts that serve to redirect criminal defendants who have a behavioral health disorder out of incarceration and into treatment. $7.5 million over the biennium in new funding for specialized dockets would be used to create 30 new drug or mental health courts. The budget continues to provide flat funding for substance use stabilization centers, which are detox and withdrawal management centers, and other mental health crisis stabilization centers spread throughout each of Ohio's 6 state psychiatric hospital regions. That's funding that was created in the last budget cycle and is continued here. I can advance my slide. Another large investment is in the line item for the County Alcohol, Drug Addiction, and Mental Health Services Boards, or ADAM boards, which are slotted to receive a total of $22 million in new funding over the biennium, much of which is earmarked to expand crisis services infrastructure. So these dollars are meant to be flexible for counties to increase their capacity to provide crisis response services for families and individuals experiencing mental health crisis. The substitute bill and now the omnibus amendment kept that total dollar figure at $22 million, but slightly decreased some of the earmarks for those flexible crisis services, so that they could direct money for a new stabilization center in Loren County. Another thing I want to highlight for this line item for Adam boards is that although they're getting a large injection in new funds for these crisis services, there is a reduction in the base allocation in operating funding that is distributed to each Adam board. Currently, each board gets a base allocation of $75,000, and with leftover funds from the line item being distributed in accordance to rate of overdose deaths by county, whereas in this budget it would be reduced to $50,000 in base funding for county, again with the remainder in the line item distributed by overdose death rates. Another major initiative is in K-12 prevention education. There's an $18 million investment for local communities and school districts to purchase evidence-based prevention curriculum. Another $13 million for the department to launch a multimedia campaign to reduce stigma around mental illness and substance use disorder. And then there are $5 million also within the prevention and treatment line item for mental health first aid treatment for law enforcement. So new things coming out of the sub-bill, like I said, not a ton changed. You know, there are a few shifts around the edges to carve out new earmarks. One of the interesting new initiatives is there's a provision in the substitute bill that remained in the omnibus yesterday that requires counties to ensure that jail inmates have access to any psychotropic drugs that are covered under Medicaid fee-for-service, including long-acting injectable drugs. And also with that increases funding for the psychotropic drug reimbursement program by $1 million over the as introduced budgets. And I also listed just some earmarks that came out of the substitute bill and were preserved in the as reported version that might be of interest to folks up in Northeast Ohio. I'm sure we have quite a few Cleveland and Northeast Ohio folks on the webinar. There is an earmark for Northeast Ohio Medical University, or NeoMed, one for Chardon School District, the Belfair Jewish Children's Home, and Applewood Centers, Inc. A couple other things that came out of the substitute bill and are still in the bill. The department will be required to conduct a study of suicide rates in Ohio in collaboration with the Department of Veterans Services. The sub-bill also creates the Health and Human Services Efficiencies and Alignment Study Committee, the purpose of which being to examine alignment and administrative efficiencies across all the different state health and human services agencies. And this is another proposal that came out of the Recovery Ohio initiative to, make sure the various state agencies that, address addiction and recovery and behavioral health in one way or another are not operating in their own silos and are able to complement each other and make sure initiatives aren't being duplicated. This committee would consist of 4 legislators as well as directors from various cabinet health agencies in Ohio, as well as the governor's directors of the Recovery Ohio, Innovate Ohio, and Office of Children's Initiatives. Interestingly, the legislators in this committee would not be bipartisan. The language specifies that it would be the chairs of 2 health-related committees in each chamber, which would both be from the majority party. There are a few other Recovery Ohio initiatives that live outside of the Department of Mental Health and Addiction Services. One is around a federal mental health and addiction parity law, which is an issue that Community Solutions has started to explore more recently and will be issuing a report on later this month. but the Department of Insurance is requesting an additional $1 million per fiscal year to increase education and consumer outreach about insurance rights and consumer rights for their coverage around mental health and addiction treatment, and making sure that coverage for those services are equally accessible to what's covered under physical health services. The Department of Education also, in combination with some of the K-12 prevention funds, is also receiving a very large injection of funding for the Student Wellness and Success Initiative, which includes, I think it's around $700 million over the biennium, and that actually increased in the substitute bill above what was introduced. And that includes a lot of dollars for prevention, but also general wellness and wraparound services, physical health initiatives, services targeted to homeless youth, family engagement and supportive services, and other just, continuum of care wraparound services that contribute to wellness and our young people. And then the Department of Public Safety is receiving funding for what's being called Recovery Ohio Law Enforcement and the Narcotics Intelligence Center to enhance law enforcement and combating drug trafficking and making sure that unit is able to work in collaboration with local law enforcement. So what changed yesterday in the amended substitute bill? The only major change really that I want to highlight is the omnibus inserted a provision establishing the medication-assisted treatment drug reimbursement program, which will be similar to the psychotropic drug reimbursement program in county jails, providing funding for county jails to offer medication-assisted treatment to help treat opioid addiction, and that program would fund $1 million per fiscal year to reimburse jails offering MAT for inmates. So that's an exciting thing that came out of the substitute bill. But that pretty much wraps it up around mental health and addiction services in Recovery Ohio. So I know I breezed over that pretty fast, but plenty of more in-depth information in our issue of state budgeting matters on the introduced version, since not a ton has changed in this area. So now I'll kick it over to our next presenter to talk about Medicaid, I believe.
Thanks, Adam. Hello, everyone. My name is Loren Anthes. I'm a policy fellow in the Center for Medicaid Policy with the Center for Community Solutions. Today, I want to talk a bit about the Ohio Department of Medicaid, where we are in terms of the budget. We'll talk a bit about what was in the substitute bill, and then some things that have changed since the omnibus was introduced last night. Good news is nothing major. Just kidding there for anybody who's a Medicaid nerd. But moving forward, so in the context of funding and where the substitute bill landed, for the most part, the line items were largely untouched. We didn't see any cuts. However, we saw some increases in some distinct areas. In the context of the substitute bill, we saw the market basket rate, which was eliminated in the executive introduced version, and the introduced version remain eliminated. And instead, in its place, there is a quality incentive payment program that came in. That accounts for a majority of the increases that we saw. There was also an assisted living increase in terms of assisted living rates, which had been something that the Trade Association had been interested in for quite a while. In addition, there were a number of other provisions affecting managed care, hospitals, skilled nursing facilities, and other things sort of on the edges. Included in this, in the context of managed care, was the requirement that any rate above fee-for-service be in some sort of value-based arrangement, that there was a creation of an employment connection incentive program, that there was a prevention of contracting with providers unless they have cost estimates available to patients, It also required ODM, the department, to publish managed care performance online, and this included a report on managed care's financial performance or financial health. It also prohibited the department from limiting the number of managed care organizations with whom it could contract, which is an interesting provision given the fact that managed care in Ohio is sort of going through this re-procurement process. In regards to hospitals, we didn't see any changes to the facility fee arrangement that the hospitals had been advancing, though we did see a number of other provisions. Number one, that children's hospitals would have performance indicators developed and published. It would limit emergency room spending through the use of audits. Also, hospitals with an FQHC could not get enhanced rates if it is on their campus, although there was an exemption for trauma hospitals. It established a Medicaid version of Medicare value-based payment with hospitals. That's a pretty complicated sort of program, but if anyone is interested, you can follow up with me and I can provide you with some resources. It also, quite interestingly, allowed for a regional network of hospitals to become a managed care organization, or at least to bid in the managed care organization process. So this would ostensibly allow for a new market entrant, if you're thinking about it that way, in the managed care contractual relationship that exists between the state and insurers. So potentially providers could band together and offer an alternative insurance product. And it also had a provision regarding site neutrality in Medicaid. Site neutrality is this idea that there would be no facility fees added to people's bills. So in the United States, what we see is usually there are something called pro fees, so professional fees, those tied to the physician, and then tech fees or facility fees, which are additional fees associated with receiving services in a hospital. And there was language in there that would basically eliminate the facility fees for Medicaid, which would be, I imagine, would get a lot of attention from the hospitals themselves. In regards to skilled nursing facilities and why this is highlighted red, the market basket was removed in favor of a quality payment, but this came back in the amended substitute bill, so the market basket rate is back in. It also increased home-delivered meal rates and limited the use of snacks as a part of that home delivery service. Like I mentioned, assisted living gets a rate increase. Other things of note, the new non-emergency medical transportation system would be permissive. Transparency issues regarding cost and price came back in. There was a desire to get a pharmacy waiver that would tie in the price of pharmaceuticals to the International Pricing Index model. There was a waiver that would be required for non-medical services to be covered if there's a, quote, beneficial effect on enrollee health. It eliminated the pregnancy risk assessment form, though I think Tara touched on a little bit on how some of these had changed in the amended version. Created that alignment study committee that Adam mentioned before. And then obviously there's a social determinants of health waiver that sort of remained in the amended substitute version, the language of which is pretty open for the department. So what changed in the amended substitute bill? Well, if anyone has been paying attention to anything on social media or in the media generally around Medicaid and the substitute bill, there was a reintroduction of Healthy Ohio. Healthy Ohio, for those of you who may remember, was inserted in a budget a couple of budgets ago that essentially was a cost-sharing program that was sought by the legislature for individuals who are part of the expansion group. It would require the use of 1115 demonstration waiver, and for the department at the time to submit that to the Centers for Medicare and Medicaid Services. Eventually, CMS denied and rejected the waiver, saying that it violated the sort of objectives of the Medicaid program, but obviously things have changed since then. There's a new federal administration in place who seems to be more interested in these sorts of measures like work requirements and cost sharing. In fact, Healthy Indiana, where a lot of the Healthy Ohio language is sort of drawing inspiration from, is where Seema Verma, who's the current CMS administrator over Medicare and Medicaid, sort of was initially based and got her start with some of this policy. But to try to describe this in broad swaths, Healthy Ohio would affect everyone who is an adult in the Covered Families and Children group, or the CFC group, as well as everyone who's a part of expansion. To put that in other terms, that's about 37.7% of the total Medicaid population. So about 4 in 10 Medicaid recipients would be affected by this program. And that doesn't capture some of the adults who may have other needs. So, there might be 18, 19, or 20-year-olds who are in school or in some sort of trade program who now would be potentially required to participate in Healthy Ohio. So these individuals would have to be a part of either one of two types of parts of a program. First would be a plus account. This is sort of like a HSA-like eligibility account where it would be built on points. The method for the Buckeye account could be paid for by a managed care organization or other nonprofit organizations, and then individuals would have to make contributions as well. If individuals weren't able to contribute on a monthly basis to qualify for the Plus account, they would be kicked into the basic component of the program. Basically, if they don't make payments within 60 days, they are kicked here. No contributions would be required, but you wouldn't be allowed back into Plus unless you get caught up on payments or a single calendar year has passed. The thing that's interesting here, or at least concerning for us, is that you'd be limited to mandatory services as a baseline, which can be adjusted by the Medicaid director. It also requires co-payments for some services, but mandatory services versus optional services, or those services which would be a part of Plus, include things that I think many could argue are not necessarily optional. This includes things like pharmaceuticals, durable medical equipment such as wheelchairs, or durable medical supplies like oxygen. So literally it would be up to the director to determine which of those benefits should or should not be a part of the basic level of health care to, quote, incentivize individuals to be more active contributors to the overall costs of their eligibility. So a lot of pieces here that we're still trying to distill, but essentially it would remove a tremendous amount of benefits as a disincentive to not pay into the program. There are some exemptions if you are pregnant, if you are a person with serious and persistent mental illness, if you have cancer, and if you are in treatment and making satisfactory progress. I think that that's an interesting piece because satisfactory progress seems to be a relatively subjective term. So if you are in treatment, potentially you may have a provider or some other level of check to say, well, we don't think you're making satisfactory progress, and therefore your eligibility may be either rescinded or may not be exempted from this contribution requirement. There's also a co-insurance piece here. It's required except for the first $500 of preventative services. All other payments shall equal at least 20% of the plan's contracted payment rates. This is interesting because plans contract at different rates with different providers. So really, there's not much that consumers can do to address the issue of price. So if a plan increased their price by a lot, it's still just 20% of that payment. A provider can also charge a copayment if a participant misses an appointment or two more times than a single year. This seems a bit strange, if only because, when we're talking about parents, I know for a fact that, parents do everything they can, but sometimes, it's not the easiest thing to make your medical appointments, or things happen throughout the course of your day. So, if your doctor is able basically to affect your eligibility because of other things that are happening, whether you have a transportation issue or, your kid gets sick that day, that's a pretty significant factor that could affect whether or not, a certain service is covered. Regarding this point system, it's pretty complex, and honestly, I just still have to dive into this a little bit deeper to understand it. But it's built off of 500 points that are built into the Plus component. And like I said, that should be HSA-like Buckeye account. And the annual contribution should be either 2% of the annual income or $12, whichever is greater, with a limit around $240. Employees and nonprofits and managed care can contribute up to 50% to the Buckeye account, but they can't make contributions on behalf of individuals as a part of their quote-unquote personal contributions. It's very complicated. And it must be made monthly, so this has to happen every month. And there's still, like the last time, a process of a transferable bridge account. So let's say that you're an individual who's been in the plus side of things, who's making contributions, you have a certain amount of points. You can, and let's say that you find a job and your income then exceeds that of Medicaid, the points can follow you through this bridge account so that you can be able to purchase other medical services. I think that that's pretty complicated. And generally speaking, what's interesting about this entire proposal, recently, if anyone's been paying attention, the state of Ohio has had some challenges implementing its new eligibility system. Currently, the federal government required the department to go through a corrective action plan because there were tens of thousands of individuals who were technically eligible for the program, but were not deemed eligible, or there were delays in their eligibility process because of the bureaucracy of eligibility. If anything, the layers that are here in a much more complex system would, I think, make the state much more susceptible to people disenrolling. And in fact, there's a lot of longitudinal research conducted. Kaiser Family Foundation has great research in this area that shows that not only is the most likely effect disenrollment from some of these complicating factors, but also that, typically this doesn't work, right? This doesn't necessarily change individual behavior or economic behavior when it comes to patients. So I think we, still have a lot of questions. Right now, it's a part of the omnibus bill that's going through the states. So we'll know in a few minutes here whether or not it makes it through. But a lot of concerns here. A couple of other provisions in the context of the amended substitute bill, and you can see the provisions here, but a lot of pieces around nursing facilities. There was a loosening of the certificate of need for nursing facility beds. Like I mentioned, Healthy Ohio is back in, just a different version of it. It also allows educational service centers to participate in the Medicaid school-based health program. There's a piece here about a Summit County hospital receiving a direct stipend to address the issue of food insecurity as a pilot program. There's a number of pieces regarding the removal of the SNF quality payment and eliminating the investigatory quality powers sought through the sub-bill by the departments, by the executive branch into nursing facility quality. There's a 2677, which would change a lot around pharmacy benefit managers. So it would require the Department of Medicaid to work with the Department of Administrative Services on pharmacy benefit manager procurement. It will allow managed care plans to vertically integrate pharmacy benefit manager products into their managed care product. Would require procurement or re-procurement every 4 years. Would also increase the Department of Medicaid's oversight and transparency over the price of drugs and the formulary, and removes the substitute bill piece around the 340B provision, but creates a 340B study committee, something to watch for anyone who is interested in safety net providers and how they work on pharmacy benefits for their members. Also remove the provision around nursing facility presumptive eligibility. It would require hospitals to have an extended care agreement with skilled nursing facilities. So basically, in order to receive payment, they have to have some arrangement in place for individuals who are transitioning out of hospital settings. And it would also require the Department of Medicaid to standardize claim forms for MyCare Ohio, which is the dual eligible Medicare-Medicaid product that exists with managed care. So a lot of moving parts. There's still much to be determined about what's going to happen this afternoon. I think our biggest focus has been around that Healthy Ohio waiver. Hopefully, I think what we would like to see is probably a standalone piece of legislation. So at least this could allow for more time for people to weigh in and digest exactly what this policy would entail. But we will find out this afternoon. So with that, I'd like to provide everyone with a copy of our contact information. And then, if you have any questions, we'd be more than happy to field them. But I'll start first with a question from Ginger Christ asking, how does this version of Healthy Ohio differ from the one previously submitted? I'll go ahead and answer that, and I'd ask either Tara or Adam to weigh in if they would like. But I think the main thing that's interesting here is that there's this creation of a basic level, which essentially has the potential to eliminate all the additional services that are not required in federal law. That has some pretty significant consequences. I think not only does it have significant consequences in terms of cost, i.e., something like a diabetic amputation is technically covered in mandatory services, but pharmaceuticals that help manage diabetes are not. So in my mind, I think a lot of the provisions that are optional are really cost-saving measures, so I'm not sure what the logic is in trying to remove that as a behavioral incentive. But beyond that, I think it really brings into question, people's access to very essential things. I mean, wheelchairs, oxygen, community-based waivers. These are some things that have had a long-standing history, advocacy-wise and policy-wise, in the state of Ohio. And to disrupt that for up to 1 million or over 1 million Ohioans is pretty consequential, and is something that's severely different than what Ohio had proposed before. And I would go so far as to say, between this and work requirements, Ohio might have the most onerous eligibility program in the country if this goes through.
This is Tara. I mean, I think Loren pretty much covered it in terms of the differences between the previous one and the one that's in the version of the bill voted out of House Finance yesterday. Any other questions that folks would like to submit through the chat box? We have a few minutes here, but please, you'll have the slides available after the presentation. They actually are posted already, and then the recording of the webinar will be posted as soon as we can get that up. Feel free to jot down our email address, as we are happy to answer any additional questions about what's here, maybe things you've heard about that weren't included here. And then definitely stay tuned to our email, our 5 things you need to know this week. And if you're not part of that, please visit our website to sign up. We will be producing a similar webinar on the Senate version of the budget. You may normally see larger research pieces from us, and because of the much shorter time frame on this budget, we are hoping that these webinars are a little bit more accessible to you all to kind of digest what's there in a timely way. And as I mentioned, there is public testimony as it relates to Health and Human Services being conducted in the Senate Finance Subcommittee on Health and Medicaid next week. So if folks are interested in that, you can contact the chairman of that committee, his office, that's Senator Bob Hackett. Looks like we did have one more question come in around information about the role of school-based healthcare programs and why ESCs are being added. Loren, can you shed any light on that right now? Might be something that was added and we might need to look into it.
Yeah, I think we'll probably need to look into it, but I have worked with school-based health programs before, and ESCs have had the ability to have a certain medical role in sort of a shared service manner, but I don't know what the purpose is of the language or where this came from necessarily, but we can follow up.
Looks like that's all the questions through the chat feature. We are very thankful you all took time to join us over lunch today, and hopefully this was all helpful information to move ahead in the budget process. Please visit our website to access the slides. They're posted now. As I said, the recording will be posted later on, so if you know of anyone who missed this, feel free to share the link once the recording is posted. And again, stay tuned for additional, certainly written pieces, as well as a future webinar on the next iteration of the state budget. Thank you all again for joining us today.